The clinical notes in Asprodental are tied to procedure codes. When you mark a note as complete, the procedures in the note get moved to the ledger, and then they're ready to be billed for insurance. Today, we'll show you how to send a clinical note to be completed. Let's start with February. February is scheduled for an exam and a cleaning, and the procedures, as you can see, are already in her appointment. So we'll go to her chart, then scroll down to the upcoming appointments section, select today's date, and actually, if you didn't do any of these procedures, you can hover over and click delete to remove the ones that you didn't do. Once you're sure the appointment is accurate, you'll click the check mark, and on the bottom right, click complete. We will create a new note, and before doing anything, let's make sure the provider and the date are correct, because those will be sent to the ledger along with these procedure codes that we are marking as complete. Next, you'll fill in your note for the encounter. You can choose additional templates from the clinical note template drop down here. You can search for your name if you have multiple providers and different notes. And when everything is correct, we'll click on Save. Then back on the schedule, your front team will see that the appointment can be checked out, and the procedures that were added from the chart will appear right here. Now, what if the appointment, like in this example, does not have the procedures in it yet? Or if there are procedures, what if they're the wrong procedures? We showed you how to delete them from the chart. You can also add procedures or take them off directly from the appointment by clicking this edit button here. This is where you would add, for example, x-rays straight to the appointment. And now when we go to the patient's chart, we can click on the appointment, go to her chart, and see that today's appointment now has x-rays in it. If we did procedures, for example, a crown, we can add the crown, we can add the build-up, and take these procedures, drag them into the appointment to get them scheduled, and added to our list to complete. If you did something that is not a tooth-specific code, for example, fluoride, you would click Add Procedure, then Whole Mouth, and add fluoride. This is where you would also find all your x-ray codes, all your cleanings, prophies, things like that, under Whole Mouth. We can move this procedure to the appointment as well. Then once everything is correct, check mark the entire day, click on Complete to create a new note, unless you want to add it to an existing note, meaning that you already wrote an encounter for today, but you forgot to add some procedures, so you want to add it to an existing note. But otherwise, create a new note, make sure everything is correct, add any text that you need, and click Save. Then back on the schedule, when the front is ready to check out that appointment, they will be directed to the ledger and see the procedures that you just added from the chart.